The Mansfield Business Alliance has released their 40 under 40 list of executives, entrepreneurs, everyday people who are under the age of 40 years old who are making a difference here in the community, the next generation of leaders. And here in the studio, she's the nurse manager of the Neurotrauma Intensive Care Unit, the ICU unit at Methodist Mansfield Medical Center. In this role, she's been instrumental in expanding the hospital's neuroscience services, including the development of the thrombectomy program. We'll ask her about that, as well as the enhancement of the EEG program and the establishment of the Neurocritical Care Unit. Her leadership and contributions have been recognized through various accolades, such as D Magazine Excellence in Nursing Award and inclusion in the Texas Hospital Association's 12 Days of Healthcare Heroes. We welcome to the studio, 40 under 40, Rachel Cochran. Welcome to About Mansfield.
Thank you. Thank you so much.
And congratulations on 40 under 40.
Thank you.
How long have you been with Methodist Mansfield?
I started with Methodist Mansfield in 2016 in the intensive care unit at the bedside.
And I mentioned in the intro the EEG. It has a really long name. I couldn't pronounce it. Why don't you pronounce it for us?
Yes, it's electroencephalogram.
Electroencephalogram.
Encephalogram.
Mm-hmm. Electroencephalogram. I can pronounce it. Very good. You've been chosen as one of the 40 under 40, and what does that mean to you?
It's definitely an honor to be recognized, especially with some of the peers that I have. I appreciate it. It's definitely not why I do what I do, but it's nice to be recognized.
Did you know that you were nominated, and really, did you see it coming?
I did know that I was nominated. I think this was Mansfield's first 40 under 40, and so I didn't know how many applicants there were or what chances I had. So I was definitely flattered to get that.
In your everyday life, you're working in the neuroscience, which it deals with the brain. Mm-hmm. And what's the hardest part of your job?
I think it's twofold. I think in a neurotrauma ICU, you encounter patients and families every day who have had a sudden traumatic event that's happened that's led them to be in our unit. And so finding a delicate balance of promoting a good, healthy work environment on the unit, as well as one that can be fun, where nurses want to work, coupled with the stresses of working in a really stressful and traumatic environment, that can be very difficult. So trying to find the fun, and there is, I think, the camaraderie. We call it trauma bonding in nursing. But when you have been through really traumatic things with each other and you've supported each other in those ways and gotten to connect with patients and their families in those ways as well, it's very rewarding.
Talk about a time where you feel you really made an impact, a time where maybe the end of a project or you've just finished with a patient and you go, wow, that was really cool. It was very impactful.
I think the growth of neurosciences at Methodist Mansfield is not something that's occurred overnight. Mm-hmm. We've been working on this journey since 2021. Here we are in 2025, and we're really starting to see the impact on our community. I think the first real time that I was taken back by a situation was a 44-year-old member of the community, a mom just like me, came in with a sudden acute stroke, and we were able to perform a thrombectomy procedure, which is a clot removal in an active stroke, and it literally within 20 minutes of her procedure, she started improving. And we watched this woman discharge from our hospital in less than 72 hours. She had come in with total paralysis of one side of her body, facial drooping, and the inability to speak. And about 72 hours later, she was discharged from the hospital and was later the next day at her kids' basketball game. And, I live in this community. And my kids play sports, and I know people in this community, obviously. And so just to see the impact that we had directly on someone like me in their 40s, a mom that had this kind of freak thing happened, and when we were able to return her to her family without a lifelong disability is impactful.
Wow. You're knee deep in your career. How do you maintain? You're also a mom, and how do you work-life balance? How do you maintain it?
Well, it's laughable to think that you can do all of these things and do all of them well. I think, like every working mom, and working parent, I think you just kind of try to keep your head above water. I focus on my kids and try to, instill in them the important virtues and hope that they will be good people. That's what I'm trying for, right?
Sure.
But in my work, it's very important to me. There are a lot of things that can change in a split second, and I've got to be available to my staff as well. And so explaining to my kids what I do and letting them know the importance and value in that as well is important. But just like all parents, I think I just try to do my best.
And your kids are understanding of what you do.
I mean, to a certain extent,
Can they pronounce EEG?
No, there's no electroencephalograms happening at the dinner table.
Okay.
But yeah, they are good kids though, and they try to understand what mom does.
On your way working up to where you are today, who are some of the people that have influenced you in your career?
Wow, there's a lot. There are a lot. There are some pretty awesome ICU nurses that I have worked with. I talked to you about trauma bonding. It's a real thing, and that's something that I experienced as well. Nursing is one of those fields where you would not ever be successful without your predecessors, without the people who precept you, without the people who pull you in and teach you lessons every step of the way. I would say I had a very impactful leader who really motivated me, I think, to just think outside the box, to keep the focus definitely on the important things, but also to keep your eye on fun.
Yeah.
I think.
Because if it's not fun, why do it?
Yeah, you have to find the joy in what you're doing. You can do really important things that are really important for a lot of people, but if it doesn't keep you energized and excited, I think you lose that spark.
Well, because if it's not fun, it becomes work. It becomes tedious.
Yeah.
I come in here and I talk to people like you every day. And it's fun.
Yeah.
And it's like, I can't wait to get to the studio to who am I going to talk to today?
Yeah.
And you got to have that fun.
Yeah.
This is a two-part question, but they're related. Let's go back to 12-year-old Rachel.
Okay.
Do you have any advice now of grown-up Rachel to 12-year-old Rachel? And also, your answer may be the same for both. Do you have any advice for younger people who are interested in your field?
Yeah, I think so. 12-year-old Rachel was obsessed with musical theater. Probably not.
Nothing wrong with that.
And I still am to an extent. I think that I don't know that I would have much to tell 12-year-old Rachel, because I think that the reason why I ended up where I am is all the different things that I have done and experienced and different journeys that I went on to get here. So I don't know that I would tell her anything. I would let her just experience. But for, kids who are smarter than I am, I feel like the, youth today, there's a lot of focus on growth mindset. That phrase never came into my speaking at that age, but they sure do talk about it now and talk about, what career pathway they're choosing at that young age. I would tell any young person interested in nursing to explore all the different avenues, because there are so many different things that you can do in nursing. But I think that one thing people don't think about is how hard it is. And you really have to take inventory on your ability to deal with really stressful situations, your ability to be able to handle all the things that come with nursing, because they call us a nurse, but we are also our patient's therapist or their family's therapist at times. We are at times the, case manager trying to help them with resources outside of the hospital. We're the physical therapist trying to get them up out of their bed. I think nurses do a little bit of everything. So I would just encourage young people who are interested in it to explore all the different avenues and make sure that that's something that they're, really wanting to get into, because it's a hard profession as well.
Oh, I bet.
Yeah.
I bet. Not all heroes wear capes.
Right. Yeah.
There you go. I'm, as we conclude this interview, just going to open up the microphone to you if you want to give any shout outs, any last words of advice, anything that's on your mind. Rachel, the microphone is yours.
Yeah, this podcast is for Mansfield. It's about Mansfield. I would tell the people of Mansfield that there's a lot of exciting things happening at Methodist Mansfield Medical Center. We are in a constant state of growth. We're very, very acutely aware of how Mansfield is growing, and we want to be able to serve our population here in our community so that you don't have to drive to Dallas or Fort Worth to get care. And so I would invite people to come and visit us when we have a lot of community events that we do that are not related to being admitted.
Run with Heart
to the hospital. Yes,
we participate in Run with Heart.
And I was there. A lot of the leaders in the hospital participate in a lot of the things that we do. We enjoy serving our community, and the way that we're able to grow and reach people here in Mansfield. So,
Rachel Cochran. 40 under 40. Congratulations.
Thank you. Thank you so much.
Thanks for being on About Mansfield.
Thank you.